no es la primera vez que vienen a Barcelona, tampoco va a ser la última, no es la primera vez que están en otras ciudades españolas como es el caso de Valladolid, y especialmente Debashish Nayak, que está aquí a mi lado, arquitecto, que trabaja en los centros históricos, que trabaja sobre patrimonio, sobre conservación urbanística en la India, en varias ciudades de la India. Realmente es una de las personas más destacadas en este ámbito, en el ámbito de la conservación histórica, los problemas urbanísticos, etc. Y yo creo que además la dimensión que estos problemas tienen en la India no es la misma dimensión que tienen, por ejemplo, aquí en España, ni en ciudades como Barcelona.
This particular presentation today is named Getting the City Back to the People. We have a hypothesis that whoever lives in any place really do not know the place. Because he or she lives there. The population of Ahmedabad is around little more than 5 million, and in the old city we have 500,000 people, which is around 5 square kilometer area. So it's quite dense, and the old city is one of the very few cities in India is built out of wood. And Gujarat, this place, is very close to desert, so they never had any wood. But they imported the wood because they believed that people are supposed to live in wooden houses. This is the old city. It had a wall, and it is almost 2/3 is gone, 1/3 is still there. It has 12 gates showing the 12 direction, and the whole city was designed based on tradition. Like in Chinese, you have feng shui. So this is the first time. I mean, this is the typical house in Ahmedabad, wooden house. And it is all earthquake resistance design, one of the very interesting design. If it shakes, but it never collapses. We had a very big earthquake in 2000 where thousands of people died, but not a single building collapsed in the old city. The interesting part of this presentation is that how we could manage to connect the people with their past, with their city, and appreciate them. So we have started something called Heritage Walk, which is every city have it, but we did it with a purpose. This heritage walk starts from a temple called Swaminarayan Temple, and it ends at Jama Masjid. So you actually connect all the different religious groups through this walk. So it is not just a walk, how to involve the whole community. And also our department has been restoring gates and fort walls, and these are some snaps of before after of some houses. This is very interesting how community funded this whole project. This is also amazing transformation. And last 5 years, we have started this Ahmedabad Heritage Festival. And so we have got street theatre, kite festivals, artist painting in the street, and also I got a Spanish flamenco team came from Valladolid to inaugurate one of the program in 2009. And this is that Ahmedabad example, which is you can say very truly Indian example of how to involve people on the sideline without involving the politician and administration initially, but eventually they also become part of it and support this whole process.
I'm a nutritionist, and for the last 30 years I have founded an organization called CHETNA, Center for Health Education, Training and Nutrition Awareness. Basically, CHETNA works for women, young people and children. In India, there is a lot of good heritage, but also there is some heritage which affects the health of people. For instance, early marriage. Girls are married in the rural areas very early, with the result that before they are grown up, they bear the first child and many of the children die. The other practice which has affected a social fabric of India is the sex ratio. Many people do ultrasound and find out if the child is a girl, they kill it in the womb. So the girl children are killed before they are born and sometimes just after they are born. So we are trying to correct the sex ratio of girl children, because from the womb to the tomb, the girls are discriminated. They have poor self-esteem, they cannot decide when to marry, they cannot decide when to have their children. Often they are not even allowed to eat what they want to eat, even in rich households. Today, India has the largest amount of maternal deaths in the whole of Asia. It's only second to Africa. So we have these two Indias, the vibrant India and the not so vibrant India. And I hope that I can make the entire India vibrant through a little work. Thank you very much.